RTF was initiated structural research beginning with the left main coronary intervention registry, which has already enrolled more than 1,200 patients from 50 centers in the country. And we are having several studies in the pipeline. This program would not have been possible without commitment of 8 course directors and 8 course co-directors and an equally dedicated group of co-directors. Despite demanding clinical schedules, they came together both online and in person week after week to plan, structure and finalize the curriculum. Their shared academic ownership truly reflects the spirit of collaboration and mentorship that this course represents. We are deeply honored by the presence of our chief guest, the Honorable Sri Revanth Reddy. Since assuming the office as the Honorable Chief Minister of Telangana on 7th December 2023, his government has demonstrated a clear commitment to the healthcare access and patient protection. The early implementation of the key public health initiative, including enhancement of coverage under Ayushman's Arogyasri scheme to 10 lakhs rupees, strongly aligns with the ethos of this program, ensuring that advanced medical care is both accessible and meaningful to the population we serve. I would also like to place on record my sincere appreciation to Dr. Sharath Reddy, who is our organizing secretary, whose dedication, meticulous planning, and for the last 3 months of relentless, sleepless nights have been instrumental in bringing this inaugural edition to life. I welcome Dr. Anil Krishna, the chairman of Medicover Hospital. I welcome Dr. Hari Krishna, all Krishnas of Medicover except Sharath Reddy, and Dr. P.C. Rath, the past president and the leading cardiologist of Hyderabad. And I welcome all the faculties and partners and the teams who have worked tirelessly behind the scenes. To our fellows, this program is not just about learning techniques, it's about shaping the future of Indian interventional cardiology. I welcome you to be part of this journey as we move together from wire to wisdom. Thank you. Jai Hind.
Thank you, Dr. Pratap Kumar Garu. Thank you very much. Ladies and gentlemen, a leader who believes in Vaidyo Narayano Hari. A moment of great honor to welcome a leader for his dynamic leadership, decisive governance and people-centric vision. The Honorable Chief Minister of Telangana, in a short span, his leadership has brought renewed momentum to Telangana through bold administrative reforms, strengthened public health care, focused investment in medical infrastructure, and a clear commitment to inclusive development. His emphasis on transparency, accountability, and social welfare has set a new benchmark in his governance. Ladies and gentlemen, please put your hands together for our Honorable Chief Minister, Sri Revanth Reddy Garu's address.
Good evening, friends. I'm not a doctor, but I'm a doctor. I'm a social doctor. I have to address social diseases. With my responsibility, I have to address all these social diseases. I'm happy the Fellow India Conference is being held in Hyderabad. Over 500 cardiologists from all over India and neighboring Southeast Asian countries are here to participate. I welcome all of you in Hyderabad, Telangana. You are all successful doctors. Even after getting success, you are here to upgrade your knowledge and enhance your skills. That is the biggest secret of success. Constant learning. The day you stop learning new things or increasing your knowledge, you are closing your growth. We are feeling proud this wonderful event is being organized in Hyderabad. We are fast becoming a hub of excellence and innovation in life sciences, pharma, and healthcare. Most people cannot qualify to be a doctor. You are a special group in society. We trust our lives on your care. Never forget your responsibility towards society and humanity. As a government, we give top priority to healthcare. We are always open to working with doctors like you to improve our policies in larger public interest. Please do help us and give your suggestions and feedback. Knowledge and tech are changing the world rapidly. With quantum computing and artificial intelligence, healthcare has become high-tech work. Please keep yourself updated on the latest technology, but do not lose your people touch. As you know, we lose lots of people because of heart diseases. Let us all join in a mission to prevent heart diseases. Let us work together to save more lives. For example, if you can volunteer to teach school students CPR technique, we can save many lives in our country. We neglect preventive medicine, but society will benefit if we educate people. Finally, I request you all to improve quality of healthcare. We have to become the best in the world. Each one of you must try to become the best doctor. Thank you, doctors. Keep learning, keep serving, keep rising. Jai Telangana, Jai Bharat. Thank you.
Thank you, sir. Thank you for that very special address. On that note, I request our organizing secretary, Dr. Sharath Reddy Garu, to present a shawl, and Dr. Pratap Kumar Garu to present a special memento on this very special occasion.
Yeah. So since yesterday, we have been in a lot of discussions and academic activities in this hall. And today, we had our Honorable CM Garu here, and he addressed all of us on one aspect of CPR, as well as taking preventive cardiac care into public so that we can reduce this burden of heart disease in our society. I think that is something which saves billions for governments and for a society as well. Thank you, Honorable CM Garu, for gracing us
and for encouraging us to learn continuously and to evolve continuously, both in life as well as in profession. And as you clearly mentioned, that you are a social doctor, and we are doctors, we are treating diseases, but we also take that concept of social doctor into ourselves, and we keep doing doctor practice as well as helping you in achieving, your goal of social doctoring. Thank you, sir, for coming and encouraging us. And when we started this idea of Fellows India with Dr. Pratap Kumar sir and entire my course directors team, we did envisage, to train only 300 people in the beginning. But over a period of time, the request from people, we increased the delegates to, more than 500 and 550, and we were able to achieve a great job. And since yesterday, I've been hearing feedback from most of the delegates and most of the faculty that this is one of the best
Program, which they have attended. I thank all my faculty, all delegates, and all my course directors and co-directors, and my course chairman, Dr. Pratap Garu, for hand-holding me, for staying with me for last 3 months to make this program a big success in terms of, great learning experience, of course, which ultimately translates into great patient care in future. And I thank my colleague, Dr. Anil Krishna, Chairman and Managing Director of Medicover Hospitals, and Mr. Hari Krishna, CEO of Medicover Hospitals, because when I started working on this concept, the whole support in terms of, human resources as well as, to some extent, financial resources, these are the guys who stood behind me. That made me think of only academic program, I just forgot about how much it will cost. All that stuff is gone out of my mind, and I started thinking of only preparing a program, and making a program and giving a better experience to every cardiologist who walks into this conference. I thank both of you for being my support, not just in this conference, and also in my life. And I thank my entire research team who were with me for all the time and who are taking care of all the non-academic aspects of this conference. Dr. Chandana, Dr. Lata, and Mr. Vijay. And one person who was really doing multitasking and not allowing anything to come to me is Mr. Ravi Kiran, who is from Abbat Vascular. So these 4 guys, cleared everything around me so that I can just work for the sake of conference. I thank all of you for, supporting me in pulling off this great program. And then I thank all the delegates, who showed so much of enthusiasm. When I walked into every training hall here, every training hall was full. And when I walked into the hall, nobody was looking at, me. Everyone is on the training. So that is the kind of enthusiasm which we wanted to create in this program. And I'm very happy, and it is heartwarming to me as well as entire course team to see you all here and to hear from you all about the next program when we are going to do. And many people came back and suggested some good things, about the program to do it in the future. We are all going to, implement those things in future. I thank you all the delegates from my bottom of the heart for your enthusiasm, for your involvement into the conference. Last but not least, the entire industry which helped me in pulling up this program. So, though it is the first program, happening in our country, so everyone kept their confidence on me and my entire course directors team to help pulling this training program in a very systematic way. And one person I have to mention, though protocol may not agree, is MS Garu. He's the one guy with entire concept of course. I went to him and said, this is what I want to do. This is how I want to train. And this is how I am experimenting a training in Hyderabad with all my course team. And he immediately said, Doctor, I am behind you. You please go ahead and do it. That made me, that gave me immense confidence to work further and, do this program. And all other industry, whoever is part of it, I'm really, really thankful and grateful to all of you for keeping your confidence on us. And I can see all your faces, happy faces. Since yesterday, I'm witnessing all the happy faces who has invested on this program, learning program. And last but not least, our Promax team and media team, all of you, I'm very, very grateful to all of you and all the government bodies, who cooperated with us. We are very thankful to you. Thank you again.
Thank you very much, ladies and gentlemen. The first of all initiative taken in India. I congratulate each one of you and విచ్చేసిన ముఖ్యమంత్రి వర్యులకి హృదయపూర్వకంగా కృతజ్ఞతలు తెలియజేసుకుంటూ మే ఐ రిక్వెస్ట్ ఆల్ ఆఫ్ యూ టు ప్లీజ్ రైజ్ ఫర్ ద నేషనల్ యాంథమ్.
जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उज्जल जलधि तरंगा तव शुभ नामे जा